Hello everyone and welcome to our first Regenberg Lab podcast edition. I'm Sonia Diaz and I'm excited to speak with Birgitte Regenberg, who is Associate Professor at the Department of Biology at the University of Copenhagen and the coordinator of the CareDNA project and the EU project Circular Vision. Circular Vision is a European research project which goal is to explore the new opportunities circular DNA creates in early diagnosis and monitoring of diseases such as cancer. Hi Birgitte.
Hi Sonia. Yeah, you already mentioned that I'm coordinating this EU project on circular DNA. So I think most people don't know what it is. It's been known in cancer for many years to drive tumors, but a few groups have also described that we can find it in plasma. And we thought when we learned about this, and we had already worked on circular DNA in human for a while, we thought if you have circular DNA in cancer and you have it in the blood, maybe we can use it as a marker for cancer. So we could start diagnosing cancer early and maybe even use it for recurrence of the disease. And finally, also for maybe telling us how a cancer patient should be treated. So to achieve these goals, I work with a number of groups in Copenhagen and in United States and in Europe, and we gather together some experience and do research on circular DNA, and we develop technology to test and monitor circular DNA, among others, in tumors and in the plasma.
Sounds quite promising, and we will keep, of course, our circular audience update with the outcomes of this project here in our podcast. This European project with a group of well-known scientists in Europe, as you have mentioned, and that they are trying very hard to understand why the circular DNA made treating cancer so hard and how circular DNA can be used to diagnose cancer in early stages.
Yeah, so in this podcast, we start with a talk with Julia Sidenius Johansen, who is professor in translational medicine and who's a well-established professor and clinician at Herlev Gentofte Hospital. So what she has done that's so valuable for our project is she started several biobanks. One is the biobank that has plasma and tumor samples from pancreatic cancer patients. So we have part of these samples that we can examine when we develop our technology. She's also responsible for Rebecca, which is biomarkers for colorectal cancer. And Sonia here went and talked to her and interviewed you. And I think the first thing you asked her was how she saw this current scenario of cancer in Denmark, and how our projects from the Innovation Foundation Denmark and also from the EU project can help to increase the survival from some of these most deadly cancers, lung cancer and pancreatic cancer.
Yes, that's correct. I went to Herlev Hospital. I talked to Julia Sidenius, and she was explaining a bit about what is the current scenario of cancer in DK, and also more specifically with lung and pancreatic cancer. So this is what she said to us.
Because lung and pancreatic cancer, they are diagnosed too late. So most patients have a diagnosis when they cannot be operated, and that means that they will die of their disease. So I think if the Circular Vision project will be positive, that means that they develop a sensitive method that can be used for screening. For early detection of the cancer, this will be a tremendous good thing for the patient with lung and pancreatic cancer, which are so deadly disease and where many patients die within a few months after the diagnosis, if they're diagnosed so late. In Denmark, lung cancer is the most deadly cancer disease, and pancreatic cancer is the third most deadly. But soon pancreatic cancer will be the second most deadly cancer disease in Denmark, and it is the same as I think in all the Western countries. So we are not different from the other Western countries. The numbers of pancreatic cancer is a little more than 1,000 get pancreatic cancer each year, and nearly 1,000 die each year. I think it's much higher.
So we now learn that 1,000 people die every year of pancreatic cancer in Denmark alone, and that it's becoming the second most deadly cancer, which is terrible for the families and the patients that it affects. So of course, it's important that we can find good markers for early detection of pancreatic cancer and other cancers that are diagnosed in a late stage when the treatment is so difficult. So I asked Julia Sidenius if there is any positive outcome of the research we are doing in the Innovation Fund Denmark project and the EU Circular Vision project.
I know Birgitte has found some interesting results from some of her pilot studies, but I think she needs to show it in the long end. Yeah, but I can also say that if we didn't thought that this was a good project, we would not have been allowed to give Birgitte all these samples. You know, there's a committee that look for all the researchers who ask for blood from our studies, and if the committee don't think it is a good study, they would say no. So Birgitte passed this committee questions.
In the interview with Julia, she explained why it's so important to get funding from the European Union and also from private and public foundations as the Innovation Fund Denmark.
It is very difficult to do a good clinical and basic study without big grant support. And in Denmark, for example, there's very little, there's no money there is a little money from the hospitals, but not enough money to do research like Birgitte's project. So this project, Circular Vision, would never have been possible without a big grant from EU. And I also think it's important that to move fast, you know, it is a good idea to have researchers from different countries, because then you get a better scientific not only atmosphere, but you get better scientific thoughts, and you will solve the questions faster, I think, if you collaborate with other people.
And finally, I asked her what will happen if, for example, Brigitte Regenberg and the other partners are successful in commercializing solutions for screening and early detection, and when the cancer is coming back, is recurrent.
If Birgitte and her group will develop a sensitive test, I think in Denmark we have the different cancer groups that are we have cancer doctors connected with lung cancer, and we have the DCCCs, the Danish Comprehensive Cancer Groups for each cancer disease. And if they think this is a good marker to be used in screening, then it can be implemented. And then it can be, I think, implemented quite fast. But of course, she needs to show that it will, the test will be useful for early detection.
Thank you, Sonia. That was really, really interesting what you and Julia talked about. So for everybody who found this interesting, I'd like to tell you that we have more podcasts about cancer and other disorders like inflammatory bowel disease that we work on. So those of you who want to hear more and read more, you can go to our website, circularvision.org, where you can see a lot more about our work and to subscribe to our newsletter. So together, Sonia and I, we are from the University of Copenhagen. We'd like to thank you so much for joining us, and have a great day.